Hello everyone. Today being a special day, Mother's Day, we part of Neeravam Hearing Care Foundation would love to wish all the moms out there a very happy Mother's Day. I am joined with two other team members of Neeravam Hearing Care Foundation. Welcome Dr. Shreyas, who is an ENT surgeon for the past 10 years working at Meenakshi ENT Specialty Center at Bangalore. I am also joined with Nishant Arora from Delhi, who is the Vice President of Associations of Energy Engineers. Today, we are here to spread awareness about hearing and speech related disability in children and its implication. To all the parents out there, soon to be parents, and for folks planning to have kids, I hope today's information is going to be quite helpful. Having said that, my first question is to Dr. Shreyas. So, Dr. Shreyas, let's talk about soon to be parents. So, are there any tests and checks which they can do today to know if their fetus has any hearing related issues or not?
So thank you, Darshan, for having me on the show, and I wish all the mothers a happy Mother's Day today. So, regarding the question, yes, there are tests which can be conducted in the regular antenatal checkups. That's what we call it. So whenever a lady visits their gynecologist, they are asked to visit them at frequent intervals. Normally, their gynecologist would suggest them to go for a test at about 16 to 18 weeks. This is called a triple marker test. So what this test does is basically a blood sample which is drawn and it's analyzed. It will tell us if there are any congenital anomalies or chromosomal anomalies which are present in the child. Having said that, obvious anatomical defects like cardiac defects, all those things can also be found out. At about the same time, 18 to 20 weeks is when ultrasound of the fetus can be performed. This is called the anomaly scan. So anomaly scan is a must for every expecting mother just before their delivery.
Okay.
And it happens between 18 to 20 weeks of gestation or 20 weeks of pregnancy. In this scan, you are able to see if there are any defects in and around the ear, if there is maybe a deformed ear, if there is a low set ear, because having such differences in comparison to normal tells us that there could be some ear-related pathology, ear-related issues, which gives us a clue that there is something going on. It is not only for the ear; it could also detect defects like a cleft lip, a cleft palate. At a very young age, even in the womb, we are able to tell that the child is having some cleft anomaly, cardiac anomalies. So if we are able to detect something much earlier, well within the purview of the Indian government, if there are some major anomalies, the parents can actually plan to terminate their pregnancy at that point of time. So if there are major cardiac defects and you don't want their children to be suffering all their life with this, if there were smaller defects, we could also plan to perform certain surgeries just before the baby is being delivered. That is also happening. So the baby is brought out as the child is inside, and the surgery is performed and put back into the mother's womb. And we wait until the delivery happens. For very minor defects, we can wait and we can plan for a correction once the baby is born.
Oh, that was quite insightful. I was not aware that the baby could be taken out and you could do some procedure and put it back. That was really quite insightful. I hope this answers a lot of questions to soon to be parents. Now my next question is again to Dr. Shreyas, but this time for parents or moms who have already delivered, who are at the maternity hospital. What checks can they do to get their newborn kids checked for any hearing related disabilities? Or if they have already delivered and gone out of the maternity hospital, what can they do then?
That's a great question, Darshan. So, what I would normally suggest is every child after they are born, they go through a normally screening test. So it's a blood test again, which checks up about 50 odd disorders which could get detected. This is not covering just hearing. This covers the entire spectrum of things which could be there. It could be neonatal diabetes. It could be thyroid related issues. All that can be checked at one end. But if you're asking a question specific to hearing, then I would say autoacoustic emissions, we call it as OAE, or a BERA test, is something which every child has to undergo at the time of birth. This can be performed, within the first day of birth, up to about, if at all something comes up on this test, it can be repeated on the third day. So as early as 1 day old child can be subjected to a test like this, and this test is gives us a very good reliability. So the sensitivity of this test is very high. So if at all even there is a little bit of hearing loss, it can be picked up by these tests, and this can be followed up with a BERA test, which is a more confirmative test. Only if a child fails their initial OAE test, then we can subject the child to a BERA test, and this could be extremely helpful, especially if you're suspecting one of their parents, either the father or the mother of the child, to have some sort of hearing loss. We categorize these children as high risk individuals, and it is a must to check all the high risk individuals, especially parents with disabilities. You have neonatal jaundice which happens, so they have to go through hearing test. If the child has been in the ICU for a very long time, because they get a lot of medicines, they get a lot of supplements, so it's always best to check them. And I think that's a very good practice one has to follow at all the hospitals.
Okay, great. Thanks for the answer, Dr. Shreyas. But are hospitals, maternity hospitals, actively doing this test today? Especially hospitals that are dedicated for maternity, and also let's talk about government hospitals. Are they also doing these tests?
So it is different for a rural and urban setting maybe. In a urban setting, I would say most of the maternity hospitals are at least following practice of conducting an autoacoustic emissions, or some hospitals are even doing a BERA test. That's even better. So that's a good practice to bring in something called as neonatal hearing screening. Basically, this has been out there in the West for a very long time, and people constantly, the moment the child is born, they subject them to the test within the first 3 days, like we spoke about earlier. But in a rural setting, due to the lack of maybe awareness, many a times deliveries are happening even at home. So as long as there's no obvious deformity, they don't even bring their child to a doctor. But if the child is actually having, as in the mother is delivering in the hospital, most hospitals are probably trying to send to a place where the tests are being performed, at least for the high risk individuals. But it is still not being brought into regular practice where every child is screened for their hearing at birth.
Thanks a lot, Dr. Shreyas, for enlightening us about OAE and BERA techniques. Now, my next question is for moms. Is there a way to naturally identify if a kid is having hearing issues? So, is there a way to know in that initial phase of 1 year where mom would know that, okay, there is some problem with my kid's hearing?
So that's a great question, Darshan. Actually, it's a very important question too, because a lot of people don't have access to OAE and BERA tests, though it may be necessary sometimes. But having said that, I would say mothers are very intuitive. They have this intuition that their child is not hearing well. So that instinct is always there with the mother. So a mother can always identify even before the father if the child is hearing or not. Having said that, the most basic thing is many a times you tend to suddenly hear some loud noise. There could be a bang, and they notice that their child is not turning towards that sound. Somebody would have dropped some object, and the normal response for any child or anybody was to turn towards that sound. This normally happens after 3 months of age. So
Okay.
they try to reach out to the sound or reach out to the light. So that is a natural phenomena which is happening in children. But if somebody doesn't notice that, then that is a red flag there. So mothers generally tend to notice this first, and they bring it up to the doctor saying, "My there was a loud sound, and yet my child did not turn towards that side." The second thing would be speech. So our hearing is intricately connected to speech. Suppose we don't hear something, we don't speak that same thing. So we are able to speak certain language because we've heard that language. So hearing and speech are related. Normally, child starts to hear in the mother's womb, and by about 8 months, 10 months of age, they are able to actually say a few words. They start to babble. They are able to maybe say mama, papa, amma. So this is a normal phenomena. But if this doesn't happen within a year, that's again a red flag. So it is something which a mother should be looking forward to, and they should reach out to the doctor immediately if they find a red flag sign. And earlier they reach out, the better it is. So early intervention is always better, so it is best they reach out sooner.
Thanks a lot, Dr. Shreyas. So it was nice to see how the hearing and speech is connected. So typically we're looking at 6 months, before 6 months, where the parents would kind of notice that, or max to max a year where they would kind of identify this. Thanks a lot for that answer. And now I have another question to Nishant. So I know you're doing some research in the space of hearing in the past couple of months. So could you throw some light on how many kids are being affected in India or across the globe on a yearly basis?
Yeah, well, thank you, Darshan. So, firstly, I'd like to say Happy Mother's Day to all the mothers out there. So, to answer your question, like the WHO figures for 2023 are available for India. So, apparently, 27,000 children were born deaf last year in India alone. And this is a very large number, and the total number of children in India who are deaf is close to 6 crores, which is really alarming. And our doctors are putting in their best efforts to combat this, and the government with its schemes is also supporting like with the hearing aids as well as the cochlear implants which are being provided by them.
These are alarming numbers for sure. So Dr. Shreyas, once we know that the kid is affected, like you did mention about early intervention, what do we do next? Could you throw some light on that?
So the first step, like I told, we do a autoacoustic emissions, and then we perform a BERA. All this is done to ascertain how much hearing loss this child has. So whether the amount of disability is something minimal, which doesn't really affect their speech. Maybe it affects the clarity in their speech, but not their speech in total. They develop speech if they have some amount of disability. It's just like your glasses. So if somebody has less power, you're able to see, but not clearly. If the power were to be higher, then you're not able to see more clearly. So just like that, if somebody were to have lesser hearing loss, then we can give them hearing aids. Hearing aids are a good aid to the child. That way their speech is not disturbed. They don't have alterations in their speech. They do not mispronounce certain words, because if you're hearing something wrong, you tend to pronounce it in the same way. And having said that, if somebody is hearing loss were to be a little more than that, so if somebody were to fall into the category of severe or a profound hearing loss, this is, I say, when somebody has a hearing loss of more than 70 decibels, which is quite high, then the speech does not develop. Such children will require a little more special intervention. This is called a cochlear implant. A cochlear implant is generally left to children whose hearing disability is more, and hearing aids will not be able to support these children. So it's basically a mechanical device. It looks like a hearing aid, but there's a portion to this cochlear implant which gets surgically implanted. We perform the procedure, and there is an external device which the child will wear, and it looks exactly like a hearing aid. But this is much more powerful compared to a normal hearing aid, and the child is expected to get a near normal hearing and speech with a cochlear implant. So this being performed bilaterally, if the child is having issues bilaterally, that's one of the best interventions we can provide for the child at an early age.
Great. I just want to know some statistics. Suppose around 10 to 20 kids come to you for diagnosis. How many of them would probably need hearing aids alone, and what is the percentage of kids who need cochlear implants?
So hearing aids are maybe reserved for smaller this thing. We are talking about nerve deafness here. There can be other reasons why the child is also hearing less. It could be a simple mid-ear infections due to their common colds, which is very prevalent in the school-going children. Many of these children don't require any sort of aids. Just a set of medicines to clear up their infections will solve the problem. Having said that, if we are talking about nerve-related issues, not every child would actually go in for a cochlear implant. A smaller segment of children who have higher amount of hearing loss will actually require the cochlear implant. The numbers may differ from place to place and from country to country, but the overall incidence in India, I think there are about 6 children born in every 1,000 live births who have some sort of hearing loss, and maybe 10% or 15% of these children may also require a cochlear implant.
Great. That was a great answer. My next question is, what are the costs we are looking at, Nishant, for hearing aids or cochlear implants? Can you throw some light on that?
So the cost can actually be divided into two phases. One is the screening phase, and the second one is the intervention phase. So the screening phase actually has something like a CT scan which needs to be done. There'll be some blood work, and there'll be something called as the Bearer test and the OAE. So the Bearer test is something which is like an advanced test, whereas the OAE is the simpler test, and apparently both the tests are required. So for all these, the package is coming to around 25,000 rupees. So apart from that, like when we go into the intervention, so the operation alone can cost close to 1 lakh. So apart from that, you also need to have the device, and apparently the device is very expensive. So the device can cost something from 6 lakhs to 16-18 lakhs, and this is just for 1 year alone. So to have an implant in both the ears, which is called a bilateral, you might end up spending something on an average like a 20 lakh, and if you add up all the numbers, it can so the government is supporting implants with 1 year. So they are apparently giving one device for 1 year for every child who's having an issue.
Great. So Dr. Shreyas, you have operated kids through the government scheme. So could you tell us how many kids would benefit with this government schemes, and a little bit more about government schemes? Could you talk about that?
So it's a very good thing that the government has been very supportive. It's both the national government, the central government, as well as the state government, which are actually taking a lot of initiative in terms of hearing and its intervention. The government, the central government scheme is actually called the ADIP scheme, and it covers ages up to 5 years, and it is a very good scheme. The workup for the testing, the surgery, the cochlear implant, the device itself is all provided by the government. So we just have to take an approval from the appropriate agency, and once they've approved for a particular child, the implant is sent to us as a parcel, and we are able to implant it for that particular child. The same is with the Karnataka state government scheme. It's called the SAST, the scheme, and the scheme covers an age group up to 6 years. So we have one extra year here, which is a good thing, because many a times by the time parents approach with their children, it may be 5+ years by the time they realize the importance of this. So it is good that we have that extra buffer of 1 year with the SAST scheme. The rest of the the workup and everything is same with both the central government scheme as well as the SAST scheme. One striking feature is the central government scheme is aimed at providing implants only to people with BPL card holders basically.
Okay.
So somebody below poverty line is eligible for a central government scheme, but the state government has been generous enough to give everybody an implant. So there is no financial criteria which is coming as a cutoff to any of these children.
Mm.
So anybody having a domicile of Karnataka is eligible for this implant. So as long as they're born in Karnataka or somebody from Karnataka, they are able to get the benefit from the SAST scheme without any capping of how much they are earning. But this is provided only for 1 year.
Okay, okay. Great to know that we have such schemes from government, both state and central government. It's great to know that they're putting efforts in this direction and trying to help kids. But based on the alarming numbers which you said, the number of kids being affected with hearing, is it really enough? The government schemes are, is it really enough? Like, we are trying to raise funds through Neeravam Hearing Care Foundation. Could you throw some light on what are the steps we are taking? What is our direction to raise funds for Neeravam Hearing Care Foundation so that more kids are benefited with hearing aids and cochlear implants?
Right. So we actually have a very structured approach to raising the funds. So firstly, like, we are very clear that there is a difference between fundraising and philanthropy, and we are moving more towards philanthropy. So firstly, about the difference. So fundraising is like a one-time activity where you don't develop a relationship with the person like who's actually donating. Whereas philanthropy is something where you probably look at somebody, develop a relationship, and they also are invested in supporting the cause they are connected with. So corporates and individuals have been really supportive of our work. We have been trying to do the fundraising through a marathon which we are planning on 1st of December. Apparently 3rd of December is World Disability Day, and with that we want maximum awareness about cochlear implants. This is our very first year, so we want to make an impact and reach out to as many people as possible. Organize a marathon here in Bangalore, and we are hoping that we'll have Kapan Park as the place where the marathon will be organized, and we'll have donors giving generously in that event. Apart from that, like, through this event we will probably be making some people aware of this cause, and we'll hope that people will be coming in as philanthropy, where they will be willing to donate year after year to our cause, and hopefully, like, we'll have more funds raised through that. As far as corporates is concerned, like, we plan to reach out to 15 to 20 corporates for grants this year. We'll be writing to them about this particular cause, and if they have CSR funds, they can plan to give us these funds for these expensive operations which are there. Apart from the social stock exchange, the companies are also interested in giving CSR money as per the Companies Act 2013, Section 135, where 2% of their profits is something which they need to invest into non-profits like ours. So we plan to raise a good amount of funds from that particular pool of money, which will be there, and support our cause. Hope that answers your question.
Yeah, great strategy in place. I hope people turn out in huge numbers for the marathon, and hopefully we will keep growing from here. Um, Thanks, Nishan, for that. I want to touch upon other important aspect, Shreyas. So we talked about soon to be parents and people who are planning for kids. Is there something we can think of even before marriage? Like, we know that people marrying within the relations are more susceptible to issues like this. Or can couples do some tests even before marriage to know that okay, they're compatible, they're going to have a healthy child? Is this something we can think of to reduce this number?
That's a good question. I don't have a clear answer to that though. When it comes to compatibility, see, it is nature's way of telling that you should not marry among your relatives. You should not marry among your community as much as possible. Though that's not the reality of the situation right now. So still in India, we see a lot of marriages happening within the family many a times, and most of the marriages happen within the community. So actually, nature encourages us to mix well. That's the reason it should be out of your community, out of your religion, out of your race, ideally. So if that happens, that the genetic offspring who would come out would be much stronger than anybody else. But that may not be the reality though. So education is the key here to answer that question. So we should maybe educate parents to be, or couples who are trying to wed. They they make sure that they're not marrying within their family and their community. That is one thing. I know I may be defying certain social norms over here, but having said that, there may be genetic tests which may be possible in the future, which will test the compatibility and tell if the two couples are compatible. But I don't think we have anything in place as of today.
Okay, great to know that. I mean, the thought process was to see possibility of identifying, not even getting into the issue in the first place. So that was the reason behind the question. But thanks a lot, both of you, Dr. Shreyas and Nishant, for spending time to go through all of the questions and raising awareness on special day today, being Mother's Day. Once again, wishing all the audience happy Mother's Day, and hopefully you guys have a great day. Thank you.
Thank you. Thank you.
Namaste.